And what I'm going to demonstrate is a patient who comes in with pulmonary edema. And pulmonary edema, as we talked about in previous lectures, is a life-threatening emergency. You must recognize it and you must treat it right away. Okay, so over here I have a diagram of the heart and how the blood flows through the heart, circulation of blood. And we know about the superior vena cava, which is from the head, and then we know about the inferior vena cava, and everything, this is your heart over here, and everything empties, but this is just a model, but that's your heart, and this is your lungs. And we're going to talk about what happens when the patient goes into pulmonary edema. And of course, your alveoli, nice and inflated, and this is where gas exchange takes place. And this plays an important role in patient who develops pulmonary edema, because it's supposed to look just like how it is. It's beautiful, nice and pink, because we have gas exchange and we have oxygen exchange taking place there. So now, and I want a student, as we said, we know the heart is a pump, right? Yes. And it's pumping the blood. It comes from the superior, from the inferior, empties into the right atrium, which is the top chamber. Tricuspid valve opens and it goes to the right ventricle. And then where else? To the pulmonic valve, then to the lungs. How does it get to the lungs? And then it picks up oxygen. So that is how people who do not have heart failure, that's what happens. Now when we have heart failure, what happens to the pump, the pumping mechanism?
It gets backed up. It gets backed up into the lungs.
The heart is not pumping the way it should. It becomes weakened. And what happens, a lot of times you might think, okay, so the patient have heart failure. What's the first, what side of the heart is going to fail first? So you might think it's the right side, right? But actually it is the left side. And what we have is backward, because now instead of the blood going forward, the blood is not getting out of the lungs, it's going to be backed up. And the blood that is coming from your body cannot get to the right atrium, so we have systemic systems. You'll see changes in the patient's jugular vein, you'll see the edema. But what actually brings the patient to the hospital is the left-sided heart failure. They cannot breathe. They might be sleeping and they wake up in the middle of the night short of breath. So here you go. This is your heart, right? One of you please come over here. Hold it down and it's pumping the blood. Pumping, pumping, pumping. Now, it has to go through the valve, right? The valve cannot be defective. Pump, 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 pump. Now put your finger on here. Now, hold it down. And this is your alveoli. So this is your lungs. And what happens when the heart is not pumping effectively, come and feel it. You're going to feel the resistance. Give a push. You feel the resistance? Yeah. This is what now the heart has to work against. So what you see here, instead of the lungs circulating freely, you have this pressure that builds up in the lungs. And because of that, it's gonna cause the alveoli to leak. So the alveoli is gonna leak, and all that fluid is gonna get into the lung tissue. So pump again. And this is your lungs with all the pressure building up, right? And this is the alveoli that's leaking. You can actually feel the pressure when you are pumping, when you're, go ahead. Actually, and can you imagine all this fluid in the patient's lungs? So what do you think the patient is going to show signs and symptoms of? The patient is going to be coughing up, pink, frothy sputum. And why do you think it's pink and frothy?
It's draining.
Because it has blood in it.
Because there's blood from the alveoli. So this patient now comes in with coughing up pink frothy sputum. Now, Nurse Federica, what's the first assessment that you're going to do? Huh? So you're gonna maybe delegate because this is an emergency, isn't that so?
Yeah.
Okay, so you're gonna, he's coughing. What do you see on his face?
Sweating.
He's sweating, he's cold, he's diaphoretic. So you have to do a focus assessment. And your focus assessment is going to be on the lungs. So you're going to get your stethoscope and you're going to come over here and you're going to listen to the lungs. What do you think you're going to hear when you listen to the lungs? Crackles. Okay.